Welcome to another episode of Building Wealth and Mental Health. We have a special guest, Dr. Rachel Heatherly, with us. She has an interesting background. I think her study area is going to be an interest to a lot of folks. But what's interesting about her, because she started off in a traditional psychologist role, and now she's doing something slightly out the box. So really take notes. I think she'll be a fun listen to. So really enjoy this next episode. How you doing, Dr. Heatherly?
Doing good. I'm excited to be here today.
Awesome. Can you please explain a little bit about what you're doing now and a little bit about the population you serve today?
Yeah. So right now I work for, if you're familiar with like an EAP program, like an employee assistance program that a lot of companies will add to the benefits that they offer their members. So I work for a company called Crossover Health. I'm a fully remote position, which is really nice. So I work as a virtual psychologist on the mental health team. Part of my team, we also work with primary care providers, physical therapists, health coaches, and a lot of companies will hire us to have, I guess, provide care to their clients, their members, their employees. And so we work with companies like Meta, formerly known as Facebook, Amazon, Pepsi, Alarm.com. So a lot of these big corporations will add us on as like a preventative care team.
Awesome. How long has this group been in existence that you're working for, and how long have you been in the group?
So it started in the Bay Area as sort of the tech boom about 8 years ago or so. And don't quote me on this necessarily, because I'm kind of just repeating what I've heard and seen in my own research. But about 8 years ago, it started as a startup. And the founder, it's a really cool story, is actually a primary care physician himself. And so his whole model was, there's this gap in healthcare that focuses on preventative healthcare, right? And how do we address it in a model that is going to be helpful to everyone, but also accessible. And so through that, they have developed different clinics on site at some of these corporations, and they also do a lot virtually now. And then, of course, the pandemic came around and just everything boomed virtually at that point. So I would say they've been in existence maybe around 8 years. And then in the last 3 years or so, they're kind of in this position of not quite a startup, but also starting to be what you would consider like a big corporation and sort of the transition they're in. I joined November of 2021, I think. So I just had my first year last year. I'm rolling into my second year. And I've been on the virtual team the entire time.
Very good. So let's take it back. Back when you were a child, let's say just before high school, can you kind of describe your childhood? What was it like? What brought you joy? What were you concerned about when you were a child?
Oh gosh. I grew up in a really small town in South Carolina. And so and I grew up in around the time where we had access to the internet, but it wasn't quite what it is today. And so I would come home from school and I would play outside, right? We had a big neighborhood full of kids, and there was maybe like 10 or 12 of us running around, setting stuff on fire, building forts in the woods. And so very country, very fun, very playful, a lot of background sports and stuff, a lot of pools, a lot of just fun outside time. And then I think my hobbies were I love to read, I love to be outside. I love to be around animals. And I don't think, honestly, I think back fondly on those times, I didn't have really any worry. At the time, it was maybe like, did the neighborhood crush of the time like me back? Maybe, but it wasn't a stressful time. It was great.
That's good. When were you first exposed to psychology? Was it any time during your high school years?
No. So my first exposure to psychology was really the first time I took a course in it in college. Up until that point, I unfortunately carried, I think, a lot of stigma against mental health, where it was something that only really sad people did or crazy people. And so I had this idea from the movies. So think like Good Will Hunting, Girl Interrupted, which now I know is just grossly inaccurate. But at the time, I think it just really wasn't on my radar in many ways. Going into high school, the way my town was sort of, the way things were at that time, there was a lot of like class divides seemingly. And so being from a small town, you had like the town doctor, the town lawyer, their kids were going to four-year colleges. As someone who was more on like the lower middle class kind of outskirts, my track in my head was like, oh, I'm going to go to like a tech school and I'm going to like maybe get my associates in nursing or something. Or because most of the guys went mechanics and most of the gals went hair school. And so I was like, I don't really necessarily want any of those routes, but I know I need some type of higher education. But the 4-year college experience just didn't seem accessible to me at the time. And a lot of that was just sort of my upbringing and coming from like a blue collar family, like college wasn't on the radar. So psychology definitely wasn't on the radar.
Understood. So how did you select college? Because of your exposure, limited expectations, how did you select the college that you did select?
Yeah, so it was funny because I was always smart, right? I was always in like the advanced classes and I was always like in the class with the doctors and lawyer kids, but I just, for whatever reason, did not make that connection that I could go. And then I remember having a teacher at the time, I was telling her, it was maybe like 10th or 11th grade. And I remember her asking me like, so what's the plan, Rachel? And I was like, oh, I don't know. I think I'm just going to go to the tech school and maybe do like nursing or something. Cause there's a lot of job security in that. You make, decent money for the time you put into it type of thing. And the teacher at the time kind of had this reaction, which to this day, I kind of look back and it was so life-changing at the time where she was like, Rachel, you're so smart. Why would you be a nurse when you could be a doctor? And that was the first time I had ever heard anything like that before. And I think at the time I probably was just very flippant, just like, oh, haha. And then, but it sat with me, right? It kind of buried the seed of like, well, why couldn't I be a doctor? Like, why couldn't I go? All my friends are taking the SATs and touring colleges. So I took the SAT, did really well. And then, applied to these schools, with my friends that were, Clemson, South Carolina, Lander University, where I ended up going. And it really came down to finances for me, right? Because I knew I was not going to get help with college just because it wasn't logistically possible in my family. And so where I ended up going, Lander University, offered me a 50% financial scholarship, which was huge for me because then that meant, okay, half the school's paid for. And it wasn't the biggest school. It wasn't the flashiest school. I mean, the town was small and didn't even really have a movie theater, but it was 50% paid for. And I was like, I'm going to take it. So I ended up going to Lander University and had a great experience. Wouldn't change anything. But it definitely was a financial decision for me.
So you mentioned your first course in psychology opened your eyes to that world, the mental health. What was that feeling when you were in that class? Was your heart burning? Was it just intellectually curious to you? Like, what was it about that class that pretty much set the path for multiple years of further school?
Yeah, it was just very interesting. I think being in an environment where I love to learn, and being in an environment where you were learning about all these different aspects of history and human behavior. And it was just so interesting to me in a way that nursing felt like something that had been kind of handed to me. Like, you should go into nursing because there's job security in this. It makes sense. Whereas psychology or just any of these things, because I'd considered other majors at the time, I was like, wow, this is fascinating. And then there was this kind of scary moment where, and they were very frank with it, right? It's kind of, if you're a psych major, you've heard this, that there's no money in it. If you want money, you got to go to grad school, right? There's no money in a 4-year psych degree. But when you're 18, you're not hearing that, right? I was just like, okay, I'm in this house of learning. This is so fascinating. I'm invested in learning more for the first time. And I wasn't necessarily thinking, but they tell you that, right? I'm sure you've heard that, right? But at the time, that wasn't on my radar as much.
So when you went to college, you weren't really thinking about how much I could earn. It was more of, this is really intellectually stimulating?
Yeah. I knew that it felt like future Rachel's problem. It did. I remember thinking, because there were people I had met in college who were very like, I'm going to be a doctor. I'm going to be a lawyer. I'm going to be a business person. And I just remember thinking like, I'm just happy to be here, right? Like, this is fascinating. I'm enjoying meeting new people, getting out of my small town, and it will all work out. And that's probably really naive in many ways, but I do look back and I think there was a level of confidence in myself of just like, I'm going to be fine. So I'm going to enjoy this.
That's awesome. So during your undergraduate years, which class was your favorite class? What really clicked? Was it a professor? What class really was able to get your brain turning?
Yeah, so this the experience that really clicked for me, and that was like, oh, I want to take this to the next level in terms of, so when you're a psych major, you kind of have this understanding that there's a few careers available to you. Mm-hmm. You are like your professors and you're going to teach and you're going to do research, or you become like a clinician. And that's really it, right? And now I know there's so many other things, but at the time, that's really what you're kind of presented with in college. And so I remember at the time having this moment. I took this sexual deviance class. Mm-hmm. And I was like, this is so fascinating. The university had just hired this new professor who was coming in and was mixing things up and offering like substance abuse courses and like these very interesting topics that like for like a small town, I was like, oh my gosh, we're going to learn all these things. And it really shaped me in the sense that the sexual deviance course talked a lot about different pathologies, different deviant behaviors in that realm. And there was a lot of conversation, a lot of conflict. This particular professor really wanted to hear from us and engage with us these conversations. And so that was really fascinating for me. But as someone who was kind of starting to have this mindset of like, oh, okay, so like, what's the research of this look like? There was this particular moment where the class was, we had learned about all these things that are really off the wall, right? Like, all these different paraphilias and different experiences. And then the topic that everyone got so fired up about was masturbation. I mean, we're talking throwing books, just fervent disagreements, and a lot of religious ideology came in. And I remember sitting back and like watching this class of like 25, 18 to 22-year-olds explode over this topic with such passion when they had sort of just sat through these other things that I thought were like more like, oh, wow, like that is shocking. Mm-hmm. And so that, I say that to say that kind of started that process. I ended up creating this massive research project that looked at the relationship between conservative religious beliefs and masturbation. And it ended up kind of spreading across campus. It was by far my most successful project. I think I had like 600 people respond to it, but it was kind of the talk of the campus because it was so inflammatory, both for that time, for a small school in the Bible Belt. But I was able to take that and essentially build a career off of it. Like that really started my interest in a very niche area. And since then, everything has kind of been shaped by that experience.
Wow. It's amazing how one thing, one experience, one class can kind of change your trajectory. So you're in college and you realize that to make money, I at least have to go to grad school. How did you select which grad school? What was your thought process at that time?
I did everything wrong, Randall, the first time. I ended up applying twice. All the advantages of going to a smaller university is you get like more one-on-one attention. You get to create your own research project and have it be supported, right? But you also don't necessarily, I think I was one of two people in that class that was applying to grad school, right? So there's not a lot of support. Mm-hmm. And I did talk with my professors about what to do. But I think they didn't want to overstep, right? Or maybe there was sort of a hesitancy on my end to like seem dumb or like I didn't know. Mm-hmm. So I only applied to 3 programs. Mm-hmm. For reference, most people when they apply to like grad school or PhD programs apply to like 15, 20. So I applied to 3. And I actually got an interview at the University of Florida, and I was so excited. And I like show up for the interview day, no frame of reference. And I'm super casual. I'm wearing business casual and everyone is in suits, right? And then I was very honest in a way that I shouldn't have been, right? Like when you apply to grad school, they want to hear, oh, I want to do research. I want to give back to this university. And I showed up, I was like, I want to be a clinician and I'll research, as much as you need me to, but that's not my passion. And so I ultimately got very far in that process, but I didn't get picked because the person they did end up picking said all the things, right? It is there is a level of calculation to it. But I will say, then maybe this is where my confidence comes in. I knew I wanted to go to Florida. I knew I wanted to work in this program. I loved everything that I saw and heard. I loved that particular professor that I ended up working with. So I came back, and I remember, much to my professor's dismay, because I did get accepted into a master's program at Clemson. They're like, oh, so you're going to go to Clemson? I said, no, I'm going to take the year. I'm going to fill out these rough edges and I'm going to reapply. And I'm going to maintain this connection with this person. And I did. And I smoothed out all the edges that she gave me feedback on. And I applied the next year. I applied to way more programs, right? So I kind of knew, okay, so I need to apply to way more. But I knew I wanted this one and I got in. But a lot of it was really just, I'm not going to say I lucked into it, because I didn't. I really did focus on that year of making myself the most attractive candidate that I could. And it worked out for me, fortunately.
So how was the move going to Florida? Different climate, different, it's still the Southeast, but it's still a different type of Southeast.
Florida's different, man. Like, so Florida, I grew up in the mountains, right? So my town is kind of in the mountains. So, and then I went to school in the mid part of the state. So I was getting more humid, but we moved in July. And I remember this was the first time that my dad and we hired movers. It was my dad and I and my mom, and we were pulling this like little U-Haul trailer, because I had spent all summer yard selling because I was broke, right? So I was like, okay, I have this apartment. Now I got to put stuff in it. And so I was like yard selling all summer leading up to the move, buying like, a $50 couch off Craigslist that I like disinfected. And so I was really proud, because I ended up furnishing my entire one bedroom for like $200, right? It was great. And it was clean, to be clear, but there was this level of like, I'm moving and I have nothing. And so, but we did splurge on movers, because my dad was like, Rachel, it's going to be July in Florida, right? And I remember at the time being like, you're right. Best decision I ever made. I cannot say enough about hiring movers. But the move was long. It was scary. It was the first time I was so far away from my family. I didn't know anyone in Gainesville, and it was hot as hell in Gainesville. It was humid. I like moved there, and within like the first 3 weeks, I got mono. Don't know where I got it. Didn't even have human contact. So I didn't even get it the fun way, right? Like I got it just, I don't even know, just Florida's air. And then I was getting these headaches, and I had to like double my water intake. I think I just like stayed indoors for the first month, just afraid of like, my goodness, how do these people do it? And then of course I'm very pale. So I was just like deathly afraid of the sun the entire time I was there.
Now, what was the biggest impact as far as, well, let's take a step back. Mm-hmm. Of course, master's program has a financial commitment. How did you think about the financial ramifications of you going into a master's program? Did you receive any scholarships? What was your thought process after you were accepted and now I have to pay money to go to this master's program?
So the nice thing about that is I actually went into a dual program. So I was actually in a PhD program, and then I got my master's along the way. So they paid me. So that's a big distinction I remember learning, and was a big factor when I was like, oh, I don't want to accept the Clemson one, is because you pay them. When you go to a master's program, you pay whatever their thing is. And then in a PhD program, they pay you a stipend, but it's so low. And it's also, knowing what I know now, it's so they can get cheap labor from you, right? So the way the system is designed is they're paying you enough to like technically live, but really they're paying you in experience, right? They're like, oh, you get to teach, you get to work for us, we train you. And from that, we get to milk all that labor. And so I think that first year I was making about 17,000 a year. And that's just the fall and spring semester because you're on a stipend. You have to find your own for the summer. And so that was a big panic for me because I did the fall, I did the spring, but I had no guaranteed income for summer. And it's not like you can just like move back home. And also certain PhD programs, you can't work because you are working for the university. You are, and you are putting in 60-hour weeks between your classes, your teaching and stuff like that. So it was a struggle financially for sure. And for me, that just meant student loans, that just meant more student loans. And then I think in my anxiety, I took out more than I needed, but a lot of that was I did not want to be in a position in a different state, so far away from family and not have money. And so I was nervous about that, but also I, again, had this mentality of that is future Rachel's problem with the loans. It will just work itself out because I can't be here without them. And I knew I wanted to be there.
What was the conversation with your parents concerning how much college costs? Did you have to console them to say, hey, I'll take care of this? Was there some help provided? What was it like dealing with parents and still getting an advanced degree?
So I'm sure every family is different. So in my family, I have two siblings. So there's three of us, very close in age. And so I had always heard growing up, that when you turn 18, you have three options. You get a job and move out, you join the military, or you go to college. And if you pick the college, find a way to pay for it, right? It was kind of this running joke, but it just was the reality. It was just the reality of it probably would have been different if there was just one kid, but there was three of us. And my family was very big on doing the same for each kid. And so they were like, well, there's no way we can apply for everyone's college. So, but they would help in ways they could. So like, obviously my dad financed the move, right? He like got me the U-Haul and then the movers, or my transmission broke in my Jeep. My little $2,000 Craigslist Jeep, which I had for years, but the transmission blew like the first year I was down there and it was $2,000. Who has that, right? And so he ended up paying for that. Like, I think he put it on his credit card. And I remember, so there were ways in which they helped, but it was a very clear conversation of like, hey, you're going to have to do this, on your own, and we'll help where we can, but it's definitely not going to be like big financial contributions. It's going to be more of like, if it all blows up in your face, you can move back home anytime type of thing. But like, that's kind of how it was.
Yeah, I think what's important was it was clearly communicated, because I think once it's clearly communicated, an individual can make the decision that's really best for them. So You're in Florida. What was your experience going to college in Florida?
Very different. It was, in like a traditional undergrad, you go to your classes, you have like this time off, you make friends. Here, the way it was in my program, you have cohorts. So each incoming cohort, and for me, there were 5 of us, including myself. So I'm now in a group of 4 other people who are all very different from me. And at this point, I also noticed where, kind of like what I talked about earlier, those different sort of socioeconomic status pieces that really play out at a PhD level, or at least in my experience in grad school, because everyone in that cohort, except for myself, their parents were lawyers, doctors, professors. And I remember feeling really out of place and like, oh my gosh, did I like bite off more than I could chew? I also just did not have an understanding of what grad school was. I just knew that, okay, I need this degree to make money in my field. Mm-hmm. But what it looked like, what it meant day to day, kind of what the next 5-6 years would look like, no idea. I think I just kind of knew I needed this endpoint. And so I just did it. And then once I got in it, I learned. But there were a lot of growing pains. Like you had to be really good at sort of holding yourself accountable in terms of these projects and showing up ready to discuss, because you can't hide in a room of only 4 other people like you can in a classroom of 80 people. And so you had to really be ready to talk and engage and do the work. And it wasn't necessarily really hard. It was just a lot. There was always something that they wanted to see you doing and working on, which was different. Whereas before, not to toot my own horn, but I really didn't have to study. Things just kind of worked out. And now I'm confronted with a very different set of like, okay, time management. You need to read these 30 pages and be ready to discuss these 30 pages, because this professor is going to report back to your professor how you're doing, and you're a reflection on them, and kind of always having eyes and evaluations being done on you in such a way where before I could just kind of show up, and this time I had to like show up because it's competitive.
Yeah. Speak a little bit more on the dynamics. Individuals who have a doctorate, usually their parents have a doctorate or some level of academic, achieve some level of academic level, and which usually means they also are in a socioeconomic level. Mm-hmm. So you coming from a smaller town, having discussions, having to communicate with people who usually come with a silver spoon in their mouth. Explain a little bit of the challenges and dynamics with that.
Yeah. So socially, when you're, in my experience, it was other people around my age. So we're all like kind of 24, 25. And I think I experienced a lot of assumptions about myself. When my transmission broke, for example, I remember one of the ladies in my cohort was like, well, like, why are you so stressed? Like, I'm sure your dad will pay for it. And granted, to be fair, my dad did, but it was just that level of like, it was obviously a hardship for my parents, right? It was a big thing. I recognized the magnitude. And when this person said, it was more of just like, why are you worried? Just like get a new car. And I mean, we're talking people where like their parents bought them a home in Gainesville for them to live in through grad school, right? Like we're not talking like, it was just such a different world in terms of experiences. A lot of them were only children, so I think that plays a role as well. And I also think there were a lot of negative assumptions. Once, I shared more about my background, there were some, looking back on now, some very negative assumptions about myself, my family. I came in with a much stronger accent, than I do now. And that was something I really actively started minimizing. And that makes me sad now. But at the time, I remember thinking, I got to fit whatever this is that's here. And that is this sort of very smart, confident, like academic, right? And I look back on it now and I think it's so silly. But there was such a pressure to kind of belong and for people to see me as I belong, versus I have to convince you. Mm-hmm. And I felt like I was doing a lot of convincing. I remember my mentor at the time told me, and I think she meant to compliment me, but I remember at the time being like, man, I got to step it up. And apparently these meetings that the faculty would have, they, talk about each student, how they're doing, what do we need to do to support them, all those things. And someone had referred to me as the little engine that could. And I remember hearing that, and she meant it as a compliment, like, yeah, you got here, because I was the girl who didn't get it the first time and came back the second time and really wanted it and, made her way. But with my background, I heard that as like, ooh, I didn't love it. And so I just think there was this vibe that I felt that I had to like fit in and change myself to fit in. And I think that's really unfortunate looking back now. And that's a lot of things that have kind of followed through my career in different settings. Because, I've now made meaningful connections with other, psychologists who have similar backgrounds, right? And I just think, man, I would have loved to have had that in grad school. Because in my grad school, I just felt like the poor small town kid who like stumbled into this room and was trying to like not get caught for 6 years. And that's my own stuff, right? But that is what I carried with me for sure.
What was the most impactful class or class that you taught while you were in your PhD program?
That's a really good question. I think the one that I find I taught a lot. I love teaching, and when I was teaching, I taught several courses over those years. But I taught an intro into counseling, and I remember I really wanted to talk to these kids about really teaching them what I wish I would have known, right? And so I really made a point to, we talked about like theoretical orientations. We talked about, what counseling was, but I really had an entire segment talking about careers and like what that could be. And I remember my sort of like crowning achievement is I had a panel of like 9 people come in that I had like networked and made connections, and everything from like people getting their masters to their PhDs to different types of PhDs, different ages, different levels. And I had a whole class where people could ask them questions. And they asked questions about loans. They asked questions about like hours in, hours out, moving, and all these things like that I had experienced. Like, oh, so you get paid to go to grad school, but you don't get paid a lot, and you got to move, and you can't have a job, and all these sort of logistic things. And I remember getting a lot of feedback from my students that it was so helpful because it kind of really gave them some real world examples of what it looked like. And then a lot of my panelists, which hats off to them, like gave them their contact information. So a lot of them really mentored them through grad school or connected them to other people. And I think that's really what I really enjoyed about it, was being able to kind of help others and connect them in a way that I wish I would have gotten at that age in particular.
That's pretty impactful. So, and I believe during your PhD program, you met somebody special. Is that right?
Are you talking my husband? I did. And it's very funny. I met my husband around my 3rd year. So he got the version of Rachel that kind of had it a little more together. I remember him being like impressed by it. And I remember dating and thinking to myself, wow, if he only knew like the tape and glue that was putting this all together. But yeah, I was very lucky to make time and space to actually find a partner, invest in that relationship. That's another struggle they don't talk about in grad school. So much of your time goes into it. It's hard to date. I tried dating the first couple of years, and there was just no space, no meaningful space for a relationship. The latter half, yes, but it definitely was. I feel very fortunate that I was able to make that happen.
Yeah, when I speak to a lot of postdoc programs, I find out a lot of them are married. So it's a common thing. What advice would you give somebody wanting to find love, really want to start that portion of life while they're still studying for school? Any advice that you would give them?
Oh, gosh. Well, I can tell you, I do have advice, but I'm going to repeat some pretty, I don't even know what to call it. My first year, my cohort, 2 of us were married, and the other, well, not us, 2 of them were married, the other 3 were not. And I remember one of the more chaotic professors at the time, she just kind of loved to say what she wanted to say. She'd been there long enough, she earned that right. But she told us, like, I think the first week, she like looked at the 2 married couple and said, did you know statistically 50% of couples going into grad school get divorced? So one of y'all is getting divorced. And funny enough, that ended up playing out. And so I will say, protect your relationship if you're going into grad school, get into couples, because it definitely is a lot of changes. And so I think, I don't know. I look back and I think it's such a chaotic time. It's such a busy time, but you can make time for the things that you want. And I look back and it's like, I could have made time. I think I just wasn't ready. But I do think the challenges that come with building a relationship in grad school, especially in my case, is you're paid very little money. So you're very poor. And you're very poor, or at least whatever you define poor as, but you don't have a lot of income in your mid to late 20s, where a lot of similar aged people who have entered the workforce, like my husband was in the workforce at 22. So when I met him, he was making bank compared to me. I was like, this is great. Take me to dinner. But like, at the time, it was an adjustment for him because he's like, you're like 20, 4 and you like, why are you so broke? And so explaining that, but then also there's a lot of uncertainty in grad school in the sense of like, when you do a clinical field, you have to do a year-long internship, which is a matching process. And so you apply to places, you rank them, but similar to med school matching, you don't really have a lot of control over where you go. And so that's a big sign up too. I remember having a conversation with my now spouse and basically saying, hey, you know, in a couple of years, this process is going to happen. We'll be presumably 2 years into this. Would you come with me? You know, would we do a year apart? Like what? Because I, at that point, was really feeling myself in my mid-20s, and I just wasn't going to, you know, waste time, for lack of a better word, if someone wasn't really ready to commit. Mm-hmm. And I look back now and I'm like, man, you were really going in hard in terms of like, are you coming with me? But it was just more of that sentiment of like, understand this thing is coming. And like, I cannot get around that. And if you are married to where you live, because I also knew at that time, I was done with Florida. I was like, this place is too hot. There's too many dinosaurs. Like Disney's great, but I was ready to leave. And I basically was saying, hey, I plan on leaving, you know, with this opportunity, and I'm not coming back. And so that's part of it too, kind of just like meeting someone. And the last part, you know, I obviously have a lot of thoughts on this. It's hard in grad school, or it's hard where I went with the University of Florida being such a large university in a small town, like it is a college town. Mm-hmm. Everyone is a bit transient. Like I was dating and meeting other people in PhD programs who were going on to their careers or their jobs with, you know, Facebook and stuff. And so it's kind of, how do you build a life together when you're doing your own thing? And I feel very fortunate that my partner already had a career that was established, has a very, a career you can pretty much go anywhere with. He's in marketing. And so that was very helpful because that meant he basically followed me for a few years. Mm-hmm. But not everyone, you know, is open to do that. So that is a consideration.
Last question on the relationship. What was the selling point to get him to move? What was the word combination, the behaviors? Like somebody who, like you said, started at age 22, working, probably slightly comfortable. How did you convince him to move?
Well, Randall, it was me.
There we go.
No, it was just this sense of, I know I'm joking, but it was like, hey, if you want to be with me, and we had a really great relationship. We were very much so connected and in love. I like to think it was an easy choice, but he did take a weekend to think about it, to be fair, because his whole life was in Jacksonville. His friends, at that time, his parents had moved, but like, you know, it was a big ask, and I recognized that. And so I think the selling point was more, you know, I think what I said, looking back on it, I think I said, let's try it, you know, because I had also lived in Jacksonville with him at that time. I was friends with his friends. I liked our life there, right? And I remember saying, if we don't like it, we can always come back, right? Jacksonville's big enough, I could find a job. I knew I didn't want to come back, and I was confident that once he got out of Jacksonville, you know, once you kind of move from your hometown, it's different, right? And since then, we've bounced around. We've been in the Atlanta area, and he's really enjoyed it. And now he's very much so would never go back to Florida because he now has experienced seasons. He's a big fan of spring. He's a big fan of fall. Those things don't happen in Florida. And so it was the right move, but it was a while there where it was a big move for sure.
That's funny. So you mentioned that you had to apply to a lot of programs while you were in your PhD program. Explain a little bit what a practicum is, and what was one of the most impactful practicum that you experienced?
So with, you know, in the PhD program that I was in, there is a training process. And so you come in, and your first year is really just like classes, like take your stats class, your theoretical classes, you kind of get introduced to like counseling. And then your second year, you start doing these practicums. And so the second year practicum is one that they do for you. They get you a practicum at the local college counseling center, which at Florida, I think is honestly the largest in the country, or maybe the second. So it's huge. And then after you do that, you get to pick your own. And so they have these relationships with different practicum sites. So for example, in Gainesville, there was the VA, the South Georgia, North Florida VA system, which was huge. There was the hospital system through the Shands, the University of Florida. There were also the local crisis center. I mean, you could go make your own. I had a friend who went to the elementary school because she was interested in working with kids and devised a practicum. So it's basically where you go and they pay you technically, but it's like you volunteer your time and you work there and you get training there. And so you work with, a supervisor doing the clinical work. And then the longer you're there and you build expertise, you start working more independently. So when you do that over 2, 3, 4 years, and ideally each year you're kind of doing something new, exploring something new, that by the time you're going off on internship, you should, in theory, kind of have an idea of the setting you want to work in. You have experience in that setting, and you're ready to devote an entire year to it. So it's kind of a lot of, for me, it was a lot of dabbling. There are some people who come in and they know. They're like, I want to work in this area. I know that for a fact. So they just dedicate the entire time. For me, I wasn't sure. I had never worked in a clinical setting before, so I wanted to try them all. And then, of course, I found areas that I preferred more. I learned a lot about what I liked, and then that really informed where I did my year-long internship.
So where did you settle on the area that you wanted to specialize in? Like you said, you can do the youth, you could do adults, you could do transition, individuals in transition. Where did you settle on later in your PhD program?
So definitely adults. I tried the kid thing. It was not for me. It takes it's the same thing about like kindergarten teachers and stuff. It's just a special person who can relate and do therapy with someone so young. I tried teenagers. I did not care for that. So I was able to suss out pretty quickly that I worked best with adults. And then through that, I really preferred, I'm not going to say older adults, because now that I'm older, it feels that's not accurate. I didn't necessarily love working with college age kids, like 18 to 22. There was just a lot of angst and stuff going on. I like to work with people like in their mid 20s upwards, right? Like I really enjoy adults with like adult problems and I don't mean to be minimizing, but I just really enjoyed working with adults. And I really enjoyed working in places that I had access to resources. That was a big thing, when I worked at the College Counseling Center, when I worked at the VA hospital system, when I worked at the Florida hospital system, when there were high needs, I could connect them to a primary care physician. I could connect them to a resource. I could connect them to a social work to kind of work through this issue, right? So I had access to resources. One of the more meaningful but also stressful experiences is when I worked for the local crisis center, which offered free counseling services, but also partnered with emergency service personnel to respond to emergencies in the community as a mental health crisis counselor. And while there were tons of really powerful experiences within that, I felt really stressed doing that job because I would be working with people and I didn't have anything to offer them, right? They would have these high needs. There would be a high level of mental health stress, a high mental health need. And then because they are in lower income settings or, it's a free therapy clinic, there was just not much I could offer. And I remember feeling really dysregulated in that process. And I had colleagues who thrived. They loved it. They're like, wow, this is so great. And I was like not sleeping well. I was like, I can't, this is not for me. And so I really appreciated that experience because it really helped me realize where I work best in. And then also I am not someone who's so selfless that will stress myself out, right? Like I also realized I needed to feel regulated to be a good therapist. And that was not a setting for me.
Very good. So when did you realize how much you could make in this profession? When did somebody pull you aside and say, this is the average psychologist makes, this is the average psychologist in your field? When were you exposed to salary and income information?
Grad school. So it was the third year. We had a professor who, and I really appreciate him for this. He started a career in psychology seminar that was in the evenings. And basically it was, you could come if you want. I attended all of them. And he would have all these professionals in the community in different disciplines, all psychologists, but in different areas, come in, talk about what their job was like, you know, how much they made, what their day-to-day was like, how they got there. And that, again, was another one of those eye-opening experiences of like, wow, I don't know anything about what is possible. And I remember hearing from a consultant, and to be honest, I still don't really understand what a consultant is in many ways, because they're always consulting on something so specific that you're like, how did you even get to that? She was a consultant for TBIs, traumatic brain injuries, in movies. And she would, you know, that was her thing. And I remember thinking, how the hell do you even get into that? It's so cool. So if you hear, I mean, I'm always keeping my ear to the ground for stuff like that. But, you know, and then other people who are like in private practice, people who worked with school systems, people who did testing for the jail system, people who did testing just privately and made a lot of money. And then people at the VA. And at that time, you could see I'm financially motivated in many ways, because at that time I was like flirting with these different practicums, and that really solidified the VA for me, because coming out of internship, you made the most money there, right? And you had a salary increase that was guaranteed. You had the benefits. There was a lot of job security in that. And I remember thinking, that's for me. Like, I want to end this with financial security. And again, you know, thinking back to like my background, I was already kind of playing that risk game of like, what is grad school? I'm deeply in debt at this point with student loans, and they have that loan forgiveness program at the time. So I remember thinking the VA is it. And a lot of that was learning how much they made out of internship.
Very good. So you have achieved your doctorate. They now call you Dr. Heatherly.
Yeah.
What is that like, coming from the town you came from? You're a long way from home. What was the feeling? Was there a feeling of accomplishment? Was it something that you always thought would happen? What were you thinking when you achieved your doctorate?
It was so surreal. I remember, you know, everyone came down for the ceremony, and I remember being hooded, you know, so they hood you in the stadium. And it was funny because the person who was hooding me was like significantly shorter than me. So I'm doing like this very powerful squat while she's putting it over my head. And there's this picture my husband took where I'm kind of looking up at the big screen, and I'm just like joy. I'm just emanating joy. And I remember, and then I almost bust my butt going down the stairs. But that's, you know, that's pretty on par. But I just remember feeling such a sense of accomplishment and just kind of being like, wow, I did it. And then like almost immediately this sense of, now what? You did it, right? Like now it's like, okay, now you have to be the doctor, you have to do the thing. And it always felt also like weirdly disconnecting with my family, because it's almost not a joke, but it's like, I don't think they really knew for many of the years what I was doing. Like, you know, because I remember I think they had this assumption when I would like do these things, they're like, what are you doing? And I'm like, you know, like, I don't know. So I feel like there was this period of 6 years where no one really knew what I was doing. But then once I was done, I could say, oh, I have my doctorate. I'm a psychologist. I work for the VA. That is something they could understand. Like the whole process of grad school and what that meant was so foreign, it seemed like.
Very cool. So you've accepted a job at the VA. Explain what you did at the VA, the population you served, and what was the connection you had with that job at that time?
Yeah, so I did my training, my internship at a VA. I did my postdoc at a VA, and then I ended up getting hired at that same VA as staff. So by the time I got hired, I had been there like a couple of years. I knew the players, I had a reputation. So I felt I literally I ended my postdoc on a Friday, and then I came back to work on a Monday. And just was suddenly just making more money, but I was in the same role, the same job. I was very fortunate that I was able to develop my postdoc into my job. Essentially, there was a need in the clinic that I was able to fill, and I was able to create some programming and basically create the case of like, hey, this is a unique thing I can offer. You know, you should hire me for this. Let me do this the last half of my postdoc and show you that I can do it. And it worked out. And so they hired me to continue in that role. So I was able to kind of just transition into my job, like a warm handoff, if you will. The only thing that really changed was the amount of money I made. I was doing the same thing the whole time. I just got paid more.
Very cool. Very cool. So now you're receiving a full salary, compensation for all the years that you've been studying. What did you do with this newfound money? How did that affect, your relationship? What was it like earning a grown-up wage?
It was surreal. There were some tough years there where my now spouse and I would talk about, it was almost like the delicious meal you're going to eat at the end of your diet or your fast or whatever, where we used to like lay in bed and stress about money. And then we'd be like, you know what, but next year I'll make twice as much. And the year after that, I'll make twice as much, right? Because the way that it works is it almost doubles for those first 3 years. And I just remember getting to that point where I was making the twice as much. And we just kind of had this moment where we had to really look at our finances in terms of, okay, now we were getting by, but now it's like, okay, now you have to do the adult thing, right? You have to like invest or whatever that means. You have to rebudget. I think we had a lot of debt from our wedding and, dumb decisions you make when you're younger. And so we also had this sense of like, okay, how do we like be adults with this money? Because both of us, my husband and I, both came from lower income backgrounds and had a lot of bad habits, either ourselves or modeled for us. And so we really had this conversation of like, we want to do it differently. We're in a position to be in a very different tax bracket than either one of us grew up with, have any understanding of. And I wanted to learn what rich old white men do. I wanted that type of approach to my money. And I had no idea what that meant, but I knew what I wanted. I was like, I want to, just be fine and not have to worry about money and be more than fine.
Mm-hmm. Yes, that makes sense. So now, while you're at the VA, were you doing something different? Were you just doing general counseling for anybody who needed a counseling session? Was it a niche that you had?
Yeah, so I was more niche. So at the VA, there's different clinics, right? So there's the general mental health clinic, there's the trauma clinic, the substance abuse clinic. I was in the health clinic, and so the health psychology clinic. So as a sort of health psychologist of sorts, I worked with people who had comorbid health conditions like diabetes, chronic pain. They might be trying to learn how to manage their hypertension. And so we would sort of partner with their physical medicine team and add support in that area. My specialties in particular, I focused a lot on chronic pain and sexual health. And so that's actually the clinic that I built for that VA. There was an existing sexual health clinic that only served a very small population of conditions and a very small population of veterans. Mm-hmm. And so I came in and saw that there was a huge group of people being left out. And so I was like, we can expand this. This is what it would look like. And so I saw, as a result, a lower caseload, which was nice because at the VA, they will give you tons of patients. But being in a specialty clinic, I was able to regulate my caseload because some of the folks I was working with needed to be seen more frequently or just had different needs. There's a lot of collaboration with other disciplines. And so having that flexibility was nice. But it was definitely still a strong caseload for sure.
How is it being kind of viewed as potentially a sex expert? Like how is that you're in the office and you're dealing with a lot of people's sexual experiences or sexual performance challenges? How is that?
It's interesting. There's a lot that goes. So when you're trained, like, let me say this, there's a lot of sexism in the world, right? And so being a woman working in this field with working with a population that is overwhelmingly older male veterans, you get those experiences where they come in and they see you and then they're like, at the time I looked younger, right? Like I didn't have the protection of doctor, right? So it was just Rachel. And so there were a lot of experiences where I had to be very intentional with how I spoke, how I presented, the boundaries I kept with people. A lot of that changed when I could introduce myself as Dr. Heatherly, right? Because then it's like, oh, she's a doctor. But personally, I think I have such a strong background in working with sexual health concerns and wellness that to me, it's like talking like about the weather. And I think my comfort with it puts the patient, in comfort. And I also do a lot of work to normalize that, any type of sexual health concern is a part of your health and wellness, right? And while it can feel awkward to talk about it, it's an essential part of your health. And fortunately, there's a strong intersection, or maybe unfortunately, a strong intersection between chronic pain and sexual wellness. So the worse your pain gets, the more difficult it is to have different types of sex. And so having those conversations with people, I would get a lot of reactions from people of like, oh, wow, I'm so glad you asked me about this. This is something my wife and I struggle with, and we don't know what to do with it. So I think it helped a lot of people feel seen. And I think it also legitimized a part of people's health that they don't often talk about or don't get asked about. And so it is one of those things that if you ask, people will tell you. But if you don't ask, and many providers don't, it just kind of goes untreated for many years.
Wow. So any tips that you would give somebody who's thinking about working at the VA, how to survive the VA system? The VA is a different place. Any advice that you would give somebody going into that world?
It's funny enough, even though I don't work for the VA anymore, I have a lot of love for it because it is such an excellent training program. If you want what I consider to be some of the best training in psychology, I always say go VA. Because what they do is they are usually the first to create and trial evidence-based practices. You're going to get the most up-to-date training through the VA. You're going to get a really structured system that asks a lot of you, but supports you. So, what that looks like for me is, I got to see veterans who were high risk, veterans who did have a lot going on, veterans who had a lot of complex issues. And so I really got to experience, really flexing my clinical skills of like, what can I help with? Where do I fit into this? But also having the structured support system of the larger VA system, right? Medical doctors, different programs, being able to send someone to rehab and explain and literally walk them to the door if needed, right? And so I think all of those things made me an exceptional clinician in many ways. I think longer term is where a lot of people burn out with the VA because there's always like just a high need, right? And depending on which VA you work at, what I was starting to struggle with is, I was getting more and more people put on my caseload. And so I couldn't see them as frequently. And suddenly I was seeing people every 6 weeks, every 8 weeks, right? Because that's just when my next opening was. And it didn't feel like the type of therapy that I wanted to be doing. And I found myself similar to that crisis story I told earlier, where I found myself sort of losing my spark or my joy for the work. It kind of felt like, I would get excited when someone would cancel or if no show. And I just had this moment where it's almost like, you remember in high school, you had that teacher, you had the teachers who like were really great and life-changing and like really brought a lot of energy to class. And then you had the older teacher who was just tenured and there for retirement, right? They were just kind of showing up. And I remember thinking, I'm going to turn into that if I stay. I remember thinking like, I don't think I'm going to be the type of clinician or professional that I want to be if I stay in this position. And so I explored other opportunities and was very fortunate to find something that's a really good fit. So that would be my sort of my advice to people, that I would wholeheartedly support training with the VA, working at the VA. The level of experiences and just access to care you have is unmatched in my opinion. But I usually think it takes a special person to go long term in the VA. And I think for me, a lot of it was just the slog of the bureaucracy and what that looks like. And then of course, my own personal tapping point of probably could have gone a few more years, right? But I didn't want to be, I didn't want to lose my spark, and I felt that it was dimming.
So you find yourself not wanting to lose your spark, and now you have to apply somewhere, or somebody has to recruit you. Explain the transition from your first job to now transitioning to another job, or were you a veteran at going to different situations because of all the practicum you've experienced?
I mean, so I will say I'm a big advocate for networking. networking in college and high school and grad school, network wherever you are. I remember having this moment where I was presenting my first year of grad school at one of the conferences, and this guy came up and he was asking me about my poster, and he was dressed basically in his pajamas. And I remember thinking, like, but I was raised right? I was raised in the South, so I gave him the same quality and attention and spiel that I gave everyone else. And he ended up being a department head for a major university who offered me a job, candidly. It was like, hey, call me in 5 years when you're done. This was great. Like, I would love to hire you. And I remember my colleague my advisor at the time being like, that is what it is. It's like the people who are dressed down at these things are like the secret, Elon Musk of these things.
Mm-hmm.
And to be honest, I probably, if I had remembered his name, I would have shot him an email, when I was I have no problem about networking like that. But I will say, when it came to that time of things, I was at the VA. I knew I wanted to leave, but of course, financial security is big for me. I did not want to leave before I had something else set up. Like, that's not how I do things. And so I started considering, like, okay, would I want to do private practice and slowly transition, so basically start doing private practice like in the evenings or on the weekends. And then when I built up enough of a caseload, make the jump, right? Or did I want to explore other options? And this is where networking comes in, because a good friend of mine had recently gotten hired at a company and was really loving it. And they had an open position. And he called me and said, hey, this position's opened. Are you interested? I mentioned your name. They said to send your resume over. And so I immediately sent my resume, which had recently been updated, and it was ready to go. And I sent it. And so I got hired that way, where it just kind of letting it be known that I was available. And then, of course, having these relationships really paid off in that sense.
What is the biggest difference between the work you did at the VA compared to what you're doing today?
Gosh, so many differences. Let's start like clinically. I see far fewer patients. At the VA, I was seeing maybe between 27 to 30 a week. Which 5 days, I think at that time I was doing 410s, that's around like, don't check me on my math, but like, I don't know, 6 to 8 a day, back to back to back. And then, so currently I see about 15 a week. And so what that allows is a much higher quality of therapy, right? I'm able to see people weekly, every other week. And so what I'm seeing is that they get better faster, right? Like, it seemed at the VA, I was never getting anyone better. And so at my current job, because I can see people every week, every other week, by session 12, 15, 16, 20, they're good. And so I've really been able to experience, okay, so when you are involved clinically to this level, you see those improvements. You actually see people get better, and you see really the benefit of therapy, which has been really nice. The lower caseload, I think, really contributes to that. Also, the flexibility. One of the things I really enjoy about my current position is that it's virtual. Yeah. So that's nice for me. I don't have to wear pants anymore. I can work at home. No one ever sees me from here below. It's nice. The commute's real short, but I will say it's nice that the people I work with also benefit from that virtual service, right? I cannot tell you how many times I'm working with people on their lunch breaks and they're sitting in their car in the parking lot, right? Or, their kids are at day camp, and this is just the 2 hours that they have. And so it makes care accessible in a way. I think it really breaks away from this traditional idea of we need to be in an office and you need to be on my couch and here's my Kleenex. I think it really makes therapy accessible to an entire generation of people who are busy and have families, have jobs, have very busy lives, but still need support and help. And so that's been a big shift as well.
Very good. Are they still coming to you with the same challenges? I think the VA, you mentioned pain management, sexual health. Are you still seeing people about pain management, sexual health, or is it different?
So yes and no. So there's definitely, I think, a wider spread of more common presentations. So because I work with a lot of people who work for corporations like Meta and Amazon, I'm seeing a lot of young professionals struggling with burnout. working a lot with like managing work stress. I work with a lot of people on just like depression and anxiety, learning coping skills. If you were to think of sort of the more basic mental health stuff, but it's also the more general mental health stuff, right? Everyone struggles with depression or anxiety at times. Everyone is wondering, suddenly I'm 30 and is this what I want to do with my life, right? They kind of have these moments. And so I work with a lot of people more on, I would say, bigger life transition questions. I also do a lot in my job with program development on chronic pain and sexual health. And that's something I'm really excited about. Because while I still work with people clinically, it's not like the primary driving force like it used to be, but my company has a large interest in providing asynchronous care. So, handouts, modules, again, we work with busy folks. So, a video that someone can watch on coping skills versus having to schedule a therapy and talk with me about it, right? And so I do a lot of program development around coping skills, especially around like chronic pain and sexual health and things like that. So a lot of it is exciting for me because it's not just like a clinical work. It's like I get to write things, I get to create content, I get to edit things. Like it's just a different skill set and it's very fun.
Very cool. What would be your biggest advice on somebody managing stress at work? What is something you see that is a consistent thing that pops up again and again? Like they had this behavior, if they thought about it this way, it would really help them out.
I think by and large, it's boundaries. It's probably the biggest thing I talk with folks about is understanding kind of where you fit into your work life and your personal life, where you want that to be. So I'm a big proponent of, what is more important to you, work or family, right? Or work or free time. And then if that's not reflected in your behaviors and your boundaries, then that is that conversation to have. And so a big difference for a lot of people, and one that I've personally implemented, is taking your lunch break. I cannot tell you how many people work through their lunch break or will eat during a meeting. And that's usually one of the first things I say, like, take your lunch break, leave your desk, especially my folks who work from home, go outside, I don't know, like just go somewhere else into a different room, take that lunch break, and I'm also a big proponent of, you're replaceable. I don't know any other way to say this. Work will replace you in a minute. So why, unless you own the business, why sacrifice your physical health, your mental health, your sleep schedule for a business or an entity that will literally replace you tomorrow if needed? I just read where, what was it? I saw it literally this morning where, I don't know if you're familiar with this, the movie Toy Story 2 ended up getting erased from the hard drives on accident. And the entire production was saved by this one woman who had it on a drive at home, just by accident, took it home in her purse. So she saved the entire movie. Okay. And this was like years ago. She got laid off from Pixar yesterday. Right. And so I feel like that is that sentiment. And honestly, I'm probably going to use it in my sessions. It's a good example where everyone is replaceable. So I always give kind of that very, reality check for folks, because I think there's a lot of reasons that go into it. But I think a lot of people of this generation and older have this, work hard ethic and sort of, sacrifice yourself for your job and, work is most important thing. And I think for a lot of people, they're discovering, especially through the pandemic, that was not the case, or they don't want it to always be the case. And so a lot of shifting of perspectives, I think. But taking the lunch break, back to your question, probably the number one thing I advocate: boundaries and just taking that lunch break, or I don't know, leaving your work environment just for like 15 minutes, walk in the parking lot can be such an important piece.
That's really good advice. As a professional to date, what has been the accomplishment that you as an individual are most proud of?
Oh my goodness. What am I most proud of? Okay, so I think this is a bit of Randall. Wow, I'm really okay. I know I have an answer. When I was in grad school, I was a part of this organization called Strive, and it was a student-run organization that really provided education about like sexual assault prevention and bystander intervention. And I ended up creating my own position there. I think I called myself special projects coordinator or something. And I basically revamped the program, and we created a lot of fun events on campus that were educational. And one of them was Cupid's Consent Fair, which actually is still in place today. And it's been 5, 6, I don't even know how many years. And it's only gotten bigger. And I remember that being my brainchild, right? And I remember making this huge set of wings. And we had this, like, we paid like a local fright guy to like walk around as Cupid and like hand out candy. And it was like this massively attended event. And we got these local student, like both on campus and off campus. And so I think seeing that, because that is such a passion area of mine, but seeing it maintain and seeing it even after I'm gone, I'm pretty sure no one there is still there that I was there, right? So it's all new people, but it's such an integrated part of their programming now that it really feels like I left this like legacy piece that embodies all the things I enjoy, which is like making information accessible, making it fun, having community partners partner and invest in it as well. And so I look back on being able to craft a giant pair of wings out of coffee filters, right? Like these things that I really enjoy, and having it last, I look back and I'm like, wow, I'm really proud of that. And I stalk it on Facebook every year, and I see it and I'm just like, wow. So that's probably it.
It's good. It's good. Now, if you can tell one thing to your 18-year-old self, thinking about the emotions that you were going through at that age, what would be the number one thing you would tell her?
I would really want to sit down and have a conversation about seeing like my value at that time and what I could bring. I think I carried so much of that imposter syndrome of, oh, I'm here at college, but there's so many people here smarter than me, or, just so much stuff at the time. I go to a small college and people from Clemson are applying to grad school, right? Or, I remember going on these interviews and it was like people from like these big see them on football type of colleges. And I remember feeling so intimidated. And I just wish I could go back and just say, like, you bring so much because of your experiences. You are so different than all these people. You bring a unique perspective. The things you have done are so valuable and so different. And and I just wish I could have really sat down and like showed myself that there are things there that really served me incredibly well. Mm-hmm. And a lot of those people that I was intimidated by, or, I'm not going to say they burnt out, but they didn't do as well, right? And I think they did things differently. And so I wish I could have seen my own like unique value at that time and really use that to go for it. I think I held back in many ways. Like I was just afraid of the rejection. I felt like I didn't belong in these spaces. And I wish I could go back and like, slap myself on the butt and say, get out there, right? Like you're great. But, it took me a while.
And for the last question, because this is building wealth and mental health, when you first started your VA job, what is the one piece of financial advice you would give your younger self?
I think, and it's a great question. If I started, and you're talking like I'm making my big VA salary at the time. I would tell myself to live more below my means. And we did that in many ways, but I think my husband and I were just so excited to not be quite so broke that we lived a little bit there for a while. And I think I would have told myself, hey, you made it work with that half salary the year before. Think of all the things you could do if you just didn't spend that other half. And so I think I would have said, buckle down a little bit more and just maybe get it out of the way or catch up. But I will say the thing that I am sort of most proud of then, and this isn't a plug, this is genuine, is that we did get a financial advisor. And that was changing for us because I think both Alan and I knew we don't know what the hell we're doing. We don't want to be in a position where we are like hand to mouth, paycheck to paycheck. And so we did find a really high quality financial advisor to kind of educate us, help us get to our goals and sort of reframe things. And that allowed me to not worry about it, which is what I love. Like, I don't want to have to worry about it when I have someone else to worry about it for me, or just tell me what to do. That's where I'm at with it now. So yeah.
All right. Well, thank you very much, Dr. Heatherly, for joining us with Building Wealth and Mental Health. I enjoyed your conversation, and I believe others will enjoy your conversation as well.
Thanks for having me. This was fun.
Take care.